And welcome to our panel session. The student homelessness is a solvable problem, and this is our Reflect and Connect session. Just a reminder that if you're not speaking, to make sure to mute your mic so that we have a high quality audio. My name is Diane Elias, and I work at Minnesota Housing. I manage a number of programs to prevent and end homelessness, including a Homework Starts with Home program. Homework Starts with Home currently is providing funding to several programs across the state, and we have an allocation of $3.5 million, which is every 2 years that we receive that funding. So our next RFP is going to be going out in the spring of 2021. And I also want to introduce some of the folks who will be on our panel today. So I will first just mention the panelists, and then I will have them introduce themselves a little bit more with my first question. So the panelists today include Dara Lee from Clay County Housing Redevelopment Authority, and Charlotte Kinzley, who is the Homeless and Highly Mobile Manager for the Minneapolis Public Schools. And in addition to our panelists, joining us today is also Dr. Matthew Morton. And you have just probably seen his session, so I will let him introduce a little bit more about himself with the very first question. So please expand on after introducing yourself, and you're welcome to add any information that I have missed so far, but please expand on your work, including how you work with the school-based programs such as Homework Starts with Home. And we'll start with Dara.
And Dara will try and remember to mute and unmute appropriately, since everybody at this session has been doing such a wonderful job. I was just saying a little bit earlier, kudos to all of you. This has been one of those fabulous online experiences. Not every one of them are, but this one has been really fantastic, I think. And all of our presenters have just been very inspiring and provided us with wonderful information. Thank you, Dr. Morton. I said, but given all the panelists today, I felt like I do have a JD I could put behind my name because I have no initials sitting there, and I think everybody else has like a whole string, and I didn't include any initials with mine. But I'm the executive director at the Clay County, Minnesota Housing and Redevelopment Authority. We are located in lovely downtown Dilworth. I am wearing headsets because my office desk is literally like 10 feet away from US Highway 10, and every once in a while there may be some honking or some sirens or some other excitement, but I promise you those are not requested sound effects. But we are right on the border with the state of North Dakota. Dilworth is a thriving community of about 4,300 folks, and we are adjacent to the city of Moorhead, which is a little bit larger, but it's they're considered a metropolitan statistical area along with the city of Fargo. But we have a combination of both rural and suburban, urban within our jurisdiction here in Clay County. So my experience with the Homework Starts with Home goes back a bit. And actually, I said I'll start out by aging myself right away. I think 30 years ago was probably when my interest was first peaked. I was a first-year law student and worked with the Temporary Restraining Order Project, or here in Minnesota we call it an order for protection. So lots of moms with kids seeking protection and oftentimes not having any place to go that they felt safe. And it really makes you think about your own experience and the experiences of others when you realize how many people out there are just really desperate to look for that safety, those basic needs of having a place to go, to lay their head down that night, and getting a meal, and trying to work with that. So, and then after that, I was a legal aid attorney for 11, 12 years with Legal Services of Northwest Minnesota, and I got to experience life in Bemidji, Minnesota, and Alexandria, Minnesota, and then in the Moorhead office. And that agency covered 21 counties in northwest Minnesota. So I say if you can name a small town in northwest Minnesota, there's a very good chance that I have been there at one point in time. And then for the past 15 years or so, I've been the executive director at the Clay County Housing and Redevelopment Authority. Oftentimes, people don't think of public housing agencies or housing and redevelopment authorities as their partners in ending homelessness for any age group. And I'm sure it was flavored by my background. I was a member of I am a continuing member of the Continuum of Care for West Central Minnesota I've been on it since 1997. I was one of the folks who really pushed and encouraged the former director here to delve into permanent supportive housing. And there was a low-income tax credit partnership with HUD Continuum of Care funds, some other funding sources that the foolish me who really encouraged him to do that got to close that deal 15 days after being on my job here. It's been an experience. So when the homework starts with home, predecessor, and this, Diane might have to help me with the name, but I believe it was rental assistance for homeless and highly mobile students,
right,
K through 12. We called it HRA Cares for Kids because I could never remember the name. Started as a pilot in 2014. We jumped all over that in partnership with the Moorhead Public Schools and our local community action program. From that partnership, we loved it. It was it's super good for staff retention to have a program like that because these are fabulous changes that you can be a very small part of that can happen in kids' lives. When our staff moved some kids into a unit, one that we owned, and they said, "You mean this refrigerator is just for us? We don't have to share it, and it's all our food in there. And I have my very own bedroom with a bed and sheets and a blanket." And they were so grateful and appreciative, and it made my very middle class mom staff just kind of stop, and the tears just kind of streamed down her face as she thought about the fact that her kids had never had to be in a position where they appreciated that. So we expanded that partnership when the pilot renewed into Detroit Lakes, the Detroit Lakes School District, and Mahabiatwa, and down to Wilkin County, which is very rural, with the Breckenridge Public Schools. And when the Homework Starts with Home came out, we ended up having 40 partners, including a bunch of housing authorities, social services, CAP agencies, mental health organizations, all the shelters and the transitional housing, and I'm not going to name them all for you. And then this last round, we have got up to 45 partners because it takes all of us in order to tackle this goal. And thank you, Dr. Morton, because we believe we can actually end child and youth homelessness in our region within the next few years, and that is our goal. And, it's our 4-minute mile. Thank you.
Wonderful. Thanks, Dara. How about Charlotte?
Yeah, thank you. So I work for Minneapolis Public Schools within our homeless and highly mobile department. And what that means is we have a team of people that really work to identify and support our students who are experiencing homelessness. At MPS, last year, we identified over 2,300 students who are experiencing homelessness, and over half of those students were doubled up or couch hopping. Before coming to this role, I've been in this role for almost 2 years. And before coming to this role, I spent 13 years in emergency shelter in Minneapolis, Mary's Place, and then 6 years at Simpson Housing, where I worked in transitional housing, rapid rehousing, and permanent supportive housing programs. And in all of those roles, I've been really lucky to have been able to work with the whole family, so the parent and the kids, and so really learned a lot from parents and students about housing impacts school, and sort of all of the barriers that get put in front of families who are experiencing homelessness. And so I really resonated with, I echo Dara's kudos to this conference today. Just that I've learned so much, and it's just gone so well. But I've really just felt connected to just this conversation around housing affordability, and that we actually do know how to end this. And when you look at the impact to education, it's nice to be around like-minded people that really believe in that, and also feel just called to really make that happen, because we know too much about the impact on young people, on students, to let this keep happening. In terms of connection to Homework Starts with Home, Minneapolis Public Schools has had a really exciting initiative called Stable Homes, Stable Schools that started in the spring of 2018 with 15 of our elementary schools that had the highest rates of homelessness. And those schools, through funding through the city and Minneapolis Public Housing Authority, those schools were able to offer sort of two different pathways to preventing and ending homelessness. One, ongoing rental assistance for families who were currently homeless. So it was up to 3 years of support, similar to Housing Choice Voucher, in that people would pay 30 to 40% of their income toward their rent. They get some support services along with that. So that was one support that we got through that. And then the other was more around prevention. So we had eviction prevention funds that were available if a family was at the brink of losing housing. And so, and then just this past year, we were able to expand that through getting a Homework Starts with Home grant. So now we have expanded to 3 additional sites. So now we have 18 schools, 18 elementary schools, and also we're able to sort of deepen our ability around the prevention work. So really exciting. Through the program, we have supported 300 families with the eviction prevention funds to stay in their home. And we have 75 families who are housed, with another about 25 who are in housing search right now. So we're really excited about sort of what that's led to. I think one thing that I was really excited about was looking at the school stability, and especially as we've been seeing some of the research today around school stability, how important it is and how hard it is, even with McKinney-Vento transportation protections, we still have students who are moving school regularly. And after our first year, a full school year with Stable Home, Stable Schools, so our district average for school stability is 86%. So 86% of our students start and end the school year in the same school. Our homeless and highly mobile students, that rate is 65%. So again, even with the protections of transportation, only 65% of our students who are experiencing homelessness start and end the school year at the same school. For our students who are enrolled in the rental assistance program, 90% of them stayed in the same school, so higher than our district average. So I think that really points to the importance of rental assistance and the extra support that they were given to really to reach that school stability factor that we think is so important and critical to academic success. So I will leave it there.
Thank you, Charlotte. I really appreciate that introduction. For Dr. Morton, I know you've introduced yourself in the panel session, but any thoughts about just the work that you have been doing with that intersection between your youth homeless work and then the schools?
Yeah, great. And hi, everybody. My name is Matt Morton, research fellow at Chapin Hall, pronounce he, him, his, and just so appreciate being with you all today. We've been doing a lot of research, as we discussed in the last presentation, around youth homelessness and youth and young adult homelessness. And I think what's really brought us so much closer and to work with the school systems is the fact that our research really underscores the missed opportunities in disrupting pathways into homelessness. And it's really deeply unethical and inefficient from a public health perspective to consistently rely on a system that disproportionately waits until students and their families have reached such a deep state of crisis that they have to come risk homelessness systems. And then not only do they have to come into homelessness systems, but they have to reach such a high level of acuity to be prioritized for a very limited set of housing resources. And that system is really backwards. So that's really brought us to the need to go more upstream. And there's no system, there's no single public system that is more of a common denominator for all adolescents and children than the schools, public schools. And we know that the research is very clear that risk for chronic absenteeism and ultimately school dropout is deeply intertwined with risk for experiencing homelessness. And those two adversities reinforce each other, and they create cycles and circles. And it's often family instabilities and trauma and early conflict and discrimination and adversity that's faced disproportionately by BIPOC young people and by LGBTQ young people. These are all the same factors that contribute to higher risk for school dropout and higher risk for homelessness. So it really underscores that, if we want to go upstream, if we want to take a public health approach and focus not just on response, but also prevention, as we do for anything from HIV/AIDS to obesity to domestic violence, we've got to start with the public system that's best suited to go upstream, and that's schools. And B, as schools care about achieving the outcomes that they're accountable for, they really need to integrate supports for young people's basic needs in their housing stability and their food security as part of that work. So that's what's brought us to this work. And we've got a model called Upstream that we've been working on adapting and evaluating inside of school systems in the United States. And we're working with federal and state agencies to use these experiences and use our evidence to influence policies in education and interagency collaboration between Department of Education and other agencies.
Thank you so much. That school intersection with housing is so important. And I think one of the opportunities that Homework Starts with Home gave to us was the ability for our department to work closely with other state departments, including the Department of Education, so that we could make those connections stronger, and also with philanthropy. I think that sort of partnership, along with, in some ways, a little bit of external accountability on the part of philanthropy, I think really helped as well. They were looking at it from a different lens, and also often more in touch with households and clients, which can really bring some great opportunities back to the state to think about doing work differently. And then, of course, our partners, as Dara mentioned, she said she couldn't name them all, but there were a lot of people that were involved in helping design our Homework Starts with Home program, trying to engage our stakeholders to make sure that it made sense what we were doing. And I think there's still that great opportunity to be able to do that better. We're learning a lot, even through this pandemic, of how we can improve some efficiencies in the way that we're rolling out resources and the way that we're planning for our programs to be able to reach the people that we actually want to be serving. And so it'll be a great opportunity, I think, over this next couple of years to be thinking about that and sort of what we're learning as we're doing this work on the ground during the pandemic as well. So for Dara and Charlotte, just a question about the morning panel. The afternoon panel. Was there anything that was sort of striking to you? Anything that you wanted to add that was maybe missing, something that you thought of during that presentation, or something that was even reassuring to you as you watched Dr. Morton's presentation? And so, Dara, you can go ahead.
Okay. I found it very reassuring, I guess, that the data lines up with what we think is happening, and also that rental assistance is not the cure-all for everything, nor are supportive services the cure-all for everything. I think that it reinforces that idea that we all have to be looking at this in a very holistic way in order to make real change in these kids' lives, and therefore in all of our lives. And I had, I have a bias, which I obviously will disclose, that I believe strongly in the Housing Choice Voucher Program, and I am familiar with the Family Option Study and the great work that has been done on that. And we have got to see through all of the different types of programs that we operate. We have permanent supportive housing for folks who are disabled and have experienced homelessness. We have the regular Housing Choice Voucher Program. We have the VASH program. We're just putting our toes into the Foster Youth Initiative. We have programs specifically targeted at single individuals with disabling conditions that are state funded. Minnesota calls it housing supports. And we've been working with Minnesota Housing for a good number of years on their Housing Trust Fund programs as well. And so we see similar impacts across all of those programs, because what it does is it takes one stressor off of households. It's like it's taking one brick off the pile that a lot of these folks have been experiencing. The pandemic, of course, came and dumped the whole semi-load back on top, and so that has been challenging for all of us. But for folks who are already trying to dig out, getting that extra pile on the top has not been helpful. But when we can provide that rental assistance resource, it really feels like we're just taking a few of those bricks off. Because most families make really good choices and really good decisions, and they just don't have any money. And it's not a matter of needing tons of supports that others would not need. They just need more money. And that's one of the things that rental assistance can provide. The other aspect, though, is that support services do factor in and make a big difference for some households, particularly those, I always say, for those parents who never learned how to parent because they were never parented themselves. They just were never taught certain skill sets. And sometimes those short-term supports can be extremely helpful. Also, if you're lacking in transportation, somebody giving you a ride is worth an awful lot, rather than spending 2-3 hours on the bus system in order to try and get something accomplished. Sometimes having a phone can really change your life. And the ability to provide those types of very small supports is really all some households need. We also have some folks who have some real significant physical, mental, and chemical health issues. And those sometimes, in order for the kids to be safe and successful, need some additional interventions to help the parents to parent as optimally as they can. So, and then the other thing is the school attendance, because boy, I think that will be helpful to a lot of our partner support services and our staff here, that sometimes it's like, why are they still not going to school? And that this program doesn't answer all the questions. And it looked like the data was saying it's not making a big, huge impact. And for some of our families it does, and for some it doesn't. And we don't have all the answers, and we keep on trying to find those magic answers. And I appreciate the data to say, yeah, that's really what's happening, good or bad, and to try and figure out different approaches we can take to get it to all go into a little bit steeper up curve. So that's, I mean, and I thought all of that information was great. I can't wait to see more of it. I know it's in the early stages, and I appreciate all the hard work those folks were doing. Misty explained to me that I have been doing something called data weaving, which I didn't know it had a name, where I'm trying to extract data from DHS and the schools and the HMIS system and our own internal, and see exactly what it does to my hair. I'm like, I have no idea why these numbers don't match up. And I think we've made a lot of progress in that area. And so I do want to report, because, just because there's been a lot of inspirational things said, but our October data for our 10-county region, and these are families that would either be experiencing literal homelessness or long-term homelessness, that we're down to 92 families in October. We have 3 out of our 4 counties that are not recording any homeless families right now. They're small population counties of Traverse, Woodine, and Wilgan. We have 4 additional counties that are only reporting 1 family or youth, and those are Stevens, Pope, Ottertail, which is a large county, and Grant. And that we have 3 counties that Douglas is down to 10, Becker 16, and Clay is sitting at 61. So we are getting down to, 4.01 on our mile here. We're getting there. And every once in a while we have to step back. And I'm going to say that the CHAP, the Corona Relief Assistance Fund, or whatever the name of it is, Diane, that you've been working so dang hard on for so long, are helping with that, because those prevention funds are coming in at a rate that have not been available to households in the past. So we are moving upstream. We are able to help them. I know Amy, who's a great resource, just came to the Moorhead School District. Those schools are out there. We have 14 partner schools, and they are identifying those kids, they're identifying those families, and they're getting the help early so that we are not seeing them flow into these numbers. Our local United Way of Cass Clay has made ending child and family homelessness its #1 goal, and has the campaign out there, and they are doing the work upstream. They are focused completely on that prevention. So we are hoping to resolve these issues for the 92 we have, and then not to add any more to the list. So we're getting there. We're getting there.
That's fantastic.
Thank you all for providing that great data.
Yeah, and I know one of the questions that we had in our request for proposal for the most recent funding cycle was, if we were giving you some extra points to this, could you end homelessness? And it was a huge risk, I think, to take, to put that question out there and just say, could you end homelessness in your continuum of care or your geographic area that you're serving if we could give you this funding? And I was impressed by the applications that came back in to say, yes, we think we can do that. Yours was one of them. It's just incredibly heartening to hear that it's actually making progress, considering we only gave you, I think, less than half the funding. So really appreciate that you're able to sort of give that feedback to us, that there are some parts of this that are still working and you're still striving toward that goal. We got to go big or go home. That's what our commissioner says. And you're an example of that, Dara, about going big. So really appreciate it. And so, Charlotte, tell us more. Oh, go ahead.
Go ahead. Say, Diane, if you could just come up with another 1.7 million, I'm sure we can get these 92 under control.
I know it. I wish I could do the 100 million again. I think that's always really helpful. But yeah, we will definitely keep striving forward on trying to get some more resources into this program. No question. How about Charlotte? Anything from you on the session and things that you thought of during the session itself, or something you'd like to add?
Yeah, thank you. So there were a few things that really stood out to me, particularly from Dr. Morton's sharing. One was just this idea of making the invisible visible and using that then to shape policy and practice. That idea of thinking about it that way, and then thinking about how we're talking about, looking at those different data sets where we are missing students, right? So even when you look at HUDs and you look at MDEs, and we know we're still missing students. And so I really just appreciate that concept. I loved your story of how a teacher made a difference. That was reassuring to me. We do have incredible people all across our state and our communities that are doing really compassionate, committed, empowering work. And so it's great to just hear an example of a teacher that really made a difference. And I know there's, all sorts of teachers out there making a difference every day. And I just appreciate all of them and all of the work that they're doing. I also really appreciated the idea of the bi-directional and interconnected nature of education and homelessness and thinking about it that way. And I think one of the things that stood out to me the most, though, was this idea of triage. I feel like so often all of us sort of working in this are feeling like, oh my gosh, we have this much, right? And we have this many people that need it. And it's just, I think it puts all of us in a really a really challenging place. Number one, to think about, look at the data about what works. Yes. And, really, can we just get to a place where we aren't working with just this much? I mean, I look at I really appreciate Housing Link. They put out, a Minneapolis monthly report, right, that shows how many units are vacant at area median income, and it separates out. And that 30% area median income, it's always zero. The last one was 1%, it moved. But I do think just this really looking at the full big picture of the lack of affordable housing as the foundational problem here was also reassuring to hear other people saying that yes, we do need to think about all these different models, and at the end of the day, housing is just not affordable, and that is the underlying problem here. And then I also really appreciate the focus on the history of how we got to where we are today, and not just taking where we are and moving forward, but we have to look back at who's experiencing homelessness. We've heard a lot about that today, about our Black and Indigenous community members that are disproportionately impacted by this. That was very intentional. There was a set of whole history of practices that led us to that outcome. And it worked, right? It did exactly what it was intended to do. And now we're here. And so really making sure that we aren't ignoring that history, but that our solutions are very targeted to those who are most impacted and who are most impacted over history. And so it's reassuring to me to be in spaces where we are talking about all of that, and that those most close to the experience are the folks that are leading not only the solutions for their own lives, but also our communities. That I think is being brought into so many spaces where it hasn't been before. And so I'm excited to see where that leadership goes. We have a parent advisory committee for stable homes, stable schools. And it's a small but mighty group of parents that without their guidance, there are so many places where we could have gone wrong. And also just to continue to inspire us, keep doing it. This is working here. Adjust this. I think those voices are so important. And so that's been reassuring, just hearing that that's happening all over the place. And I guess the one last thing I'll say is just listening to this morning, Dr. Shin talk about sort of the outcomes of different housing interventions. And I know there isn't one end all be all, but the way she was sort of showing the data just so much reflected what I've watched happen in transitional housing and rapid rehousing and in permanent housing. And different models, especially short-term models, I feel work great when we have some affordable housing. So it's if we could really move the dial on that stock of affordable housing, then I think a number of different interventions could work. But at the end of the day, that foundational piece of affordable housing just has to be addressed. And I love, Dr. Morton, how you said, yes, absolutely, we can do that. We just have to choose to do it.
Thank you, Charlotte. Dr. Morton, any comments related to the panelists?
Dara and Charlotte, thank you so much. You've given me a lot to chew on and operationalize some of these ideas and deep experience in different ways. And I think what both of you reflected back in different ways was the importance of taking a holistic systems approach. It's one thing to have a good intervention, but even in an evidence-based intervention, when we think about the youth space, there are very few rigorously evaluated programs or interventions for addressing youth homelessness, especially housing outcomes, and more for mental health treatment. And one of the few is for example, YV LifeSet, intensive case management interventions for youth that have transitioned out of juvenile justice or foster care. And it was a rigorous impact evaluation with a large sample, and it showed a statistically significant reduction of homelessness experiences among youth transitioning out of these systems. That's great, but even still, that still left over a third of youth experiencing homelessness within a year. So when we think about a program that's effective, we're looking for statistically significant results, which means it moved the needle. It doesn't mean it solved all issues for all people. And we can get into that mindset of thinking too exclusively on specific interventions, or just on rental assistance, or just on supportive services, I think, as Dara said very well. But really what we need to think about is a systems approach. What's the right continuum of supports so that we can meet any young person's need or any student's need who comes in and says, I need help and assistance. And even if you could resource all those needs for a snapshot in time, if we don't address the underlying structural issues that put students and their families there in the first place, we're not ending the problem. We might get to an effective zero for a year or a couple of years, but if we're not addressing structural racism, if we're not addressing the fact that we have stagnated wages for 20 years while we've had rapidly increased housing prices, if we're not addressing the orientation of a child welfare system towards reporting and risk rather than towards supporting family strengthening and well-being, we're not in a place where we're really going to see the systemic change that we need. So I think it's really helpful for me to hear from the two of you in these different ways about how a systems approach with a continuum of care and addressing the underlying roots of homelessness is so critical to the problem.
Thank you so much. I know that toward the end of our presentation, we're going to hear a few closing remarks, both from Dr. Morton and Dr. Maston as well. So just keeping that in mind, I'm going to combine the next question and hopefully help address one of the questions from the audience that's in the chat. But just talk about how you best match families to the right service and what kinds of supports are available for those youth, particularly those that are unaccompanied, for example. And so how are you doing this work and staying connected to them to engage them in service?
We have fabulous partners, and one of our main partners are the CAP agencies, the community action programs that operate across these 10 counties. They are our main access point for homelessness, as well as our school systems. And so when we're trying to target it, when they're coming through the CAP, they're having the overall kind of assessment, at least as far as their financial and employment. Are they receiving food assistance? Do they have health insurance? Are there small children enrolled in Head Start? Are there older children enrolled in school? And so they're getting these kind of checkups from a support services perspective. Are they connected with a mental health professional? Do they have a primary care provider? And then do they have stable housing? Now, and then if the housing isn't stable, how unstable is it? Are they living in a place where they could stay with a small intervention, or are they, on the street? And so what service they're receiving is dependent on that kind of checkup. And at our agency, by the time we get them, all the really hard work has been done. Those partners on the street have been kind of sorting through and trying to refer over to the correct places. So when we're getting them at our agency, we're just looking at the housing portion, primarily, because we do have the supportive services division too for some of the programs. But if these folks are chronic homeless, they've had multiple struggles, children or adults in the home with disabling conditions. Oftentimes, if a child has a disability, the parents have a challenging time maintaining employment as well because of the needs of the child. So then we'll be looking at a more structured, I shouldn't say structured. We'll be taking a look at a more long-term approach, saying, given these barriers, the fact that it's unlikely they're going to be able to increase their income in the foreseeable future, we're going to look at a longer-term program right off the bat because it's really important. Unfortunately, because of the housing choice voucher and all the issues that we know as far as serving a very small percentage of those who are eligible in need of it, we always have a waiting list. So what we have done is put a preference in place for folks who are receiving time-limited rental assistance through another program in Clay County and who are within 6 months of reaching the end of that time limit. So that means, because I a big supporter of Dr. Shim's there, that we're not having people fall off the cliff. We're not looking at giving people temporary help and then, oh, sorry, you didn't make it. Back to ground zero you go. We're interested in saying, oh, this wasn't enough for you. What's the next step in order for you to have a little bit more time on your journey? And so we have a preference, and I'm happy to say that since we put that preference in place, I think that, we've been able to help everybody who has reached that limit, unless they end up in jail, because then we can't really do anything. But we have also removed all of our screening criteria for the housing choice voucher, except for the federally statutorily required screening criteria, because we want to be housing inclusive and not housing exclusive. These are pretty much the easiest folks for us to house because they've already been receiving some type of assistance from one of our partners or through one of our other shorter term programs before they have moved on to this other program. So they have already maintained some types of housing stability typically. So that's kind of how we weave those issues together. We are, Minnesota has the brand new housing stabilization service available through the Department of Human Services as a Medicaid billable activity. Our agency has chosen to become a provider because we think it's critical to be able to have a whole kind of smorgasbord, to use my true Scandinavian background choice of words here, a smorgasbord of options for folks to choose from, because we want people to be successful with whatever supports that might be. And we have tried to do ongoing meetings, surveys, events with the folks that we are here to serve and to get their feedback. And they've told us, as Charlotte was saying earlier, it's been really consistent. They want help to pay their rent for deposit or application fees. They want some help looking for a job or re-enrolling in school themselves if they're adults, or helping their kids get to school and finding some daycare. They would like some supportive services for as long as they need them and then get the heck out of their lives because they don't need you anymore, because why would you be hanging around if they're okay? And then, they want us to be there if something goes south. They would like to feel like we have our backs and you're not just off this program and you can't ever come back if something happens. So, we try to look at that for that consistent, and it's just been remarkably consistent as far as what we get across the board for, and they want some help with transportation too. That's the other big one. But what we get for feedback from the folks that we are working with. And then one of the groups that are some of those 45 partners are religious organizations, because I think we have a pandemic of loneliness, even pre-pandemic of COVID, and having those social supports and meaning in people's lives. And when I was listening to Dr. Morton's presentation, that person who kind of says, I believe in you and you matter to me and you make a difference and I care about you, is so critical. And as a government entity, that is not normally our role to say we love you and we care about you and we want you to be wonderfully successful. We do, but people get kind of uncomfortable when we say it. So I think that they're all really critical to people being successful.
Thanks, Dara. I really appreciate that. Charlotte, what are your thoughts on this?
Yeah, I'll start with just talking through how we prioritize families for that rental assistance. And before I even do that, though, I just want to say that it's super challenging, as we all know, because of that sort of foundational principle of that we have just a small amount of resources around housing support compared to what we really need. And so within Stable Home, Stable Schools, that initiative is really focused on both the school and the housing piece. And so we were really hoping to capture families who want to stay at their school. They've been at that school, but because of a lack of affordable housing, they simply can't find something near their school. And so we end up transporting our homeless and highly mobile students. We had last school year, there were 70 different zip codes outside of Minneapolis where we were transporting our homeless and highly mobile students from. So really looking at how long you've been at that school. So really wanting to stabilize families that want to be at this school. And so that's one factor that we look at. Looking at housing mobility, how many moves have they had? So trying to see around that chronic homelessness, Dara, that you were mentioning. And then we look at the student. So we're looking at things like attendance, their literacy and math scores, behavior referrals, the ability for the parent to engage in school, and seeing where those are risk factors that would then prioritize that family for a referral. So we're taking a look at all those different pieces when we're looking at a referral. At the end of the day, we'll be able to serve maybe between 10 and 30% of our homeless and highly mobile students at those sites. So that's why we need a prioritization in that way. All of those families need some sort of support in order to be able to afford housing. And so that's sort of what we've come to. And so we use that screener to then decide who to prioritize for referral. We also distribute the referrals based off of the homeless and highly mobile numbers at that school. So a school with really high rate of homelessness would have more openings than a school with lower numbers. Just one comment about sort of the rate of homelessness. So last year it was 6% of our student body experienced homelessness during the school year. But I think a really more important indicator is to look at rates at school sites where students have ever experienced homelessness. And some of our schools, 50 to 60% of the student body has experienced homelessness at some point during their time in MPS. So just a note about the sort of vastness of the experience of homelessness due to a lack of affordable housing. And then the second question, just around particularly unaccompanied youth and the resources for supporting them, that Jana was mentioning in the comment box. So two different things. One, I think in terms of support for them, we also have really strong community partners. So the Youth Services Network, the Bridge, really the YMCA, really strong partners. So I think whenever we can tap into the resources that are available and connect students to those resources, we do that. I'm not saying we have everything we need to meet all the needs. We don't, but we do have really strong partners doing good work. And then within the school, I'll point to those relationships again. I mean, I think like being known in a school matters. And so right now it's where our numbers are really low. Our homeless and highly mobile numbers are low right now, which I think many districts are seeing because we're losing the touch point, right? And that touch point matters. And staff have been incredible about reaching out and doing so much work to connect. And it's really hard. And so I guess I would just point to the importance of those relationships being built at the school where a young person feels comfortable telling someone what's going on, has a relationship with someone, and that someone can respond. So I guess both of those things, the partnerships, really leaning on those, and also leaning on the relationships that we have in our school buildings.
I love that you identified that piece again about relationships and how important it is to be thinking about those social pieces. I think both of you identified that, and that's really a key piece also to making sure that there's success with these programs. I know that we have very limited time, so this last question is going to be a really fast round. In order to answer it, you have less than 30 seconds. And so the question is going to be, what patterns do you notice, either anecdotally or in your practice, that the data has not yet confirmed? And what more could researchers be doing to support your work? And so I'm actually going to answer this question while you think about it for myself. I think one thing that's really notable about Homework Starts with Home are the champions. We have the Hopkins project where someone took that on, a friend of yours, actually, Chris, that took that on and started to run with it. Dara, up in your area, being the champion for this type of work, has made a really huge difference. I know, Charlotte, the things that you're doing are just incredible. And some of that, I don't think it gets captured in the data, but I just want to acknowledge that it's often the people who are taking the initiative to make these programs come to fruition, to get resources for them, to get them off the ground. That type of work I don't think is necessarily captured in the data that we're looking at because we're looking at it on the other end. But I think it's a really important part of this program. So I will go to Dara first. You have 30 seconds.
And I'm going to say, I think that you guys are doing a great job and just keep it on doing it. We want more, but more of kind of what you guys have already been researching. And then as the fellows were discussing some of their future plans to continue with, they all sounded wonderful to me. And thank you again. It's been a wonderful session. I really appreciate everything that's happened today.
Thanks, Dara. Okay.
I'll echo the just the work that maybe isn't captured, and I'll specifically call it our school social workers that do so much of, especially within stable home, stable schools, prioritizing the families, referring them, but then providing that ongoing support that I don't think would be captured. And then one other piece is that I'm really curious about is looking at the doubled up couch hopping compared to families in shelter and the moving back and forth between the two. And it was mentioned earlier that we might be able to be capturing nighttime residents. And I think looking at that and comparing how attendance changes when you're in shelter versus couch hopping, I think would be something really interesting to be paying attention.
Yeah, that's a really good point. All right, Dr. Morton, anything you would want to do?
That's really helpful, Charlotte, and we're actually starting to do some administrative data linking that I think will kind of get at some of those issues. So I'd love to continue that. There's so many places I could take that question, but I think the one place that kind of comes to mind for right now is that increasingly we know a lot more about what leads young people into homelessness. We know much less about what factors are related to young people's sustainable exits from homelessness, not only at the interventions, but what types of supports. We've talked about relationships, we've talked about services, and the fact that different students and families will need different levels and different types of supports for stable exits. And homelessness systems data is just not well suited to follow up with young people. If a system fails a young person the first time around, they may well not come back to it the next time around. Or if a young person experiences homelessness in one COC, leaves, and then enters homelessness in another COC, they look like they're a successful exit, but in fact, they've experienced homelessness again. So we really need better data on the factors that predict sustained exits for homelessness for different students in different situations so that we can craft better systems of care around them.
Thank you so much. Thank you to all the panelists who presented today. And I also want to turn this over to Dr. Maston just to be able to give us some closing remarks.
Well, thank you. And before I close, I just want to comment that it's been a wonderful day to me, and I've been hearing many themes, repeated themes woven through the discussions and the keynote presentations where, there's a striking recognition of the complexity of this problem and its historical nature and how connected it is to fundamental injustice and intergenerational risk that accumulates in people's lives. And it's important for that reason to have a long-term historical view and trauma-informed perspectives. But I also have heard the theme of resilience and the power of protective systems to make a difference. And I also think that we, as a resilience researcher primarily in my life, we have to really move toward a multisystem perspective, intergenerational multisystem perspective, to create the kind of resources and capacity that families are going to need and students are going to need to break through this problem. It is challenging, but I'm hopeful, and I hope that we can continue in our research partnership to work together closely with all of you to try to build better and better data to inform what you're doing. We are now going to close, and I want to thank you all for attending. Many of you stuck with this most of the day, which is wonderful. We will be posting the talks and panel discussions on our website. We've already posted some of our policy briefs and podcasts based on the work of this Grand Challenge project, and we'll be posting more soon. We do plan to post all the materials from this conference, video recordings as well as other materials. And we do plan in our future podcasts to raise the voices of young people and parents about this critically important issue. The timing of this conference posed some difficulties for that this time around, but we're looking forward to future opportunities to get together in person. Our research continues, and we hope that we'll be able to share our future progress and that you will sit around the table with us and help guide the work that we're doing in the future. So take care, stay healthy, and have a wonderful weekend.
Thanks, everyone, for joining us, and really appreciate your participation today. Thank you to all of our panelists and our speakers the entire day. We greatly appreciate all of you and all the work you're doing with our Homework Starts with Home efforts. Thank you.